Okay, good evening, everyone. My name is Reagan Rosenberger, and on behalf of our working group, I want to welcome you all to the first session of the Virtual Shadowing Program. We're so glad to have you all here and hope that you enjoy the sessions. The goal of this program is to provide the pre-medical student community with the opportunity to continue to engage in shadowing hours despite the temporary closure of shadowing programs around the country due to the coronavirus. In this series, we are interested in covering subjects like patient assessment, triage protocols, the physician-patient relationship, tips for applying, and any other topics you would like to cover. On the following slide, we have presented the topics for the upcoming weeks in June. This week, we will be discussing What Am I Getting Into?, where we cover the philosophy behind the motivations for pursuing a career in medicine. Next week, June 9th, we are covering the pre-medical journey and discussing the applications. June 16th, we will cover the physician-patient interaction and give you an introduction on patient assessment. And finally, June 23rd, we will begin our specialty spotlight with emergency medicine. We are planning on the sessions to last only about 1 hour, 40 minutes of presentation, followed by 20 minutes of Q&A. So if you have any questions during the presentation, please feel free to write us a note in the chat box, and we will try to get to the question in the question and answer portion. During the session, our participants will be muted the entire time to prevent any distractions. And following the session, in order to gain credit for the hour, you will need to complete a very short assessment proving active listening during the presentation. The link to this assessment may be found on our website at virtualshadowing.com, or you can click the link that will be sent in the chat at the end. This slide displays the members of our working group. All of us are pre-meds at different aspects of our journey, and we have all known each other for a few years, and we all saw the need for shadowing hours, so we came together to make this program for you all. So I'm Reagan, we have Cheyenne, Taylor, Alana, Rachel, Ani, and Miriam. Again, we are so happy to provide this program for you all during this strange time, and we hope you gain much from it. Please let us know if you have any questions or comments by contacting us through our website or email.
Well, good evening, everyone. My name is Ray Fowler. I'm an emergency doc. I've been doing this now for 42 years. I'm professor of emergency medicine at the University of Texas Southwestern, where I'm chief of the Division of Emergency Medical Services. I'm also on the admissions committee at UT Southwestern, which I have been now for almost 10 years. And I've been working with the admissions process for now about 12 years. It is our absolute honor. This is a team approach. All the folks you just saw their pictures in the previous slide, I would like to thank them very much. We've all been friends for some time as they plotted their path toward medicine. And now with this awful pandemic that we will talk about in weeks to come, this was a time for us to say, well, what can we do about this? And so we think shadowing hours are very important. Next week when Rachel leads this session, the next session, we will talk about all the various things that are important for your application process based upon our experience, and about ways to be able to improve your application and make it really talk about who you really are. I want to thank the working group. They are just been wonderful to work with, and this marvelous enthusiasm. We put this up about a week ago, so this is new. And there seems to be great hunger for this. We put out the website about 5 or 6 days ago, and we've had some 360 people write us to ask about how to get shadowing time. So it certainly leads me to believe that there's a real need for folks to be able to get into the clinical environment. Today, we're going to talk about what in the world do you think you're doing? Do you have any idea what you're getting into? Do you really want to do this? And then we're going to make some points along the way based in significant part with my career, and I'll come to that in a little bit. We also, please put your questions, if you have one, in chat now. Reagan and the working group will screen those questions. We can't obviously answer everybody's question, but at least we'll be able to answer 4, 5, 6 at the in about 38 minutes, 37 minutes. One of the questions we want to ask you is this worth even doing at all? If y'all think so, then we'll keep doing it because it's fun for us. It's a good project. It's a scholarly thing also. We're doing this for free. We don't have funding. We're making it up. We need a web geek assistants. So if there's somebody out there who would like to work with us and give us some website advice, we would love to have that. But please, if you think that this kind of thing is of value, let us know. Let us know by chat or email us. One last thing is that this presentation will be online. So if you had to drop out or miss it, or you have friends that missed it, go to virtualshadowing.com, and you'll be able to link on the site. There is also an 8 or 10 question exam at the end. And once you complete that, if you want, we will send you a certificate that you took this hour. If we like to see people have 50 to 100 50 or more hours, maybe 100 or more hours of shadowing. Well, if we do this once a week, that's 50 for an hour at a time. That's 50 hours of shadowing, and we're willing to do it if you're interested. So with that, we'll get started. All right, folks. This is Ray to you. This is old Doc, who's been doing this forever. Half of my career was in the burbs in Georgia. I came here. Actually, yesterday was my 20th year at Parkland Memorial Hospital and at the university, so happy anniversary to me. But one thing I get to do is work with you kids as a compliment. The folks who are, if this is the bell curve of career, you're here, I'm the old guy. But I get to work with y'all, and so I want to reflect, as I just worked all weekend, this past weekend at Parkland, where I work in the ER, taking care of COVID patients all weekend. Why in the world do I want to do this? And so one of the things that's going to be one of the first points to make about you and your application process to medical school, but especially with you getting into this, is what are you doing? Do you know what you're doing? Can you state what you're doing? In 1972, when I was applying to medical school 100 years ago, if you'd asked me what my mission was, I'm not sure at all that I could have made a convincing answer to that. So, ladies and gentlemen, you must be able to state what your mission is to medical school, and how well can you express that. And we're going to talk about the interviewing process next week. And by the way, we're going to go for at least a month on this, and if we get very little enthusiasm, then we'll stop doing it. If we get a lot of enthusiasm, we have hundreds of you show up every week, then we'll keep doing this. We'll talk about the admissions process next week. You're going to have to express to somebody, especially an interviewer, before too very long, why is it that you want to do this? And you've got to make a convincing explanation about why it is that you want to do this. So what we're going to do here is that we're going to sort of brainstorm some ideas, some common reasons why you might consider pursuing medicine. A fundamental reason for doing it, a principal infrastructure of reason, is that you want to better the condition for humans. My goodness, look at the stress and strife that's on the streets of America today, up to and including last night in New York City. What a very odd time in the history of the human condition. You have to do this, you should only want to do this, I'm sorry, that's what I meant to say, if you want to get close to people and think about their conditions. It is about getting in touch with humanity. If you are not much interested in that, you are getting into the wrong field. And so first and foremost, you have to have a warm, personal, genuine interest in making things better for others. And I can't say that any more strongly. I am working on my slide here. There we are. The second part falls on to that, which is that you really want to be with people. I think that when I was the age of these young folks that are working with us on the working group, and as I suspect many of you, how very much are you into actually being involved with people in the processes of their lives, especially when they are sick? Medicine is the opportunity, it's the obligation, if you're in it, to be involved and work with people in their lives. It is the patients and it is the staff, it is both at all times. And you have to personally enjoy that. If you don't really personally find yourself really wanting to be personally involved with people, medicine may not be for you. Now, there are aspects of medicine where you're not necessarily so involved with folks. You could be a radiologist. Radiology is a wonderful field, being in a dark office looking at x-rays, and that's perfectly fine. Or you can be on the front line like me and a bunch of others, or like my friend Julian, who's on the talk tonight, who's an EMS guy who's out in the streets on the front line. But you have to ask yourself as you move forward, and then as we talk about the admissions process next week, do you really want to help impact people's lives for the better? That must be a genuine motive. And I urge you to look in the mirror, look inside yourself, get a piece of paper and a notebook like I have here, and sit down and write these things down. What is in your life that has persuaded you that getting involved in impacting the lives of others is something that defines you? Now, many of you have been sick in your lives. Many of you probably have never had a sick day in your lives. I've been blessed that I've been pretty well my 67 years. There is no more vulnerable position than when one's body becomes ill. Whatever that illness may be, it may be something acute in a motor vehicle accident. You didn't mean for it to happen. And then suddenly one finds oneself looking up from a stretcher in an emergency department at a bunch of strangers who are wearing masks, and you're having terrible pain and something acutely wrong. Or you become diabetic and you're taking insulin and your sugars are acting up and you can't seem to keep it under control. You feel awfully vulnerable. To be involved in medicine means that you have to find within yourself a desire to support others at a time that they are having weakness. This must come out of your heart, and that you become someone that they can lean on. Trust me that that is so. I will say to you, in my old age and the bell curve of being here in my career, you're over here, that there is nothing that I enjoy more than going to the bedside of Aunt Minnie, who is sick and terrified and in horrible pain, and holding her hand and taking her pulse and feeling her skin and looking her straight in the eye and say, we're going to get you some medicine and we're going to make you feel better. I'm your doctor and I'm going to take care of you, okay? Now you just stay right there. Nurse, let's go ahead and get this thing started. And so that they can feel that you are there for them. The patient is not there for you. You are there for them. As we will speak about in the weeks to come, there are some patients that are wonderfully easy to love. It's Aunt Minnie who is in pain and terrified. And we say, I'm going to get you some medicine and I'm going to make you feel better. Then I work in the busiest emergency department in the United States, Parkland. You know, there's this wild, crazy drunk. Oh, come over here, doc. I want to talk to you. You know, this goes on and this goes on. And the person is extremely difficult to like. And moreover, it's causing chaos within a quiet, reasonably quiet working environment where in the room next door, Aunt Minnie is terrified and horrible pain. And this person, the intoxicated individual, is taking so much of our time. Nonetheless, as we also will move on and discuss, we cannot be judgmental. We are there as a foundation for others. People come to us for two general reasons about their health. One is to prevent illness. The other is to manage illness. It is both. People will commonly have multiple conditions at the same time. On this medical record that we have, the electronic record, we see the people's past medical histories. It's not uncommon at all that our patients have 24 medical problems, from hypertension to diabetes to heart disease to cigarette smoking and so forth, where they had this long litany list of medical conditions. What your opportunity is in entering medicine is to help people take control of their health. Again, to prevent illness or to manage illness, and it is both. Let's take, for example, people that are very overweight. A 350-pound guy with hypertension comes to see you, who also has diabetes, he has restrictive lung disease, and a host of other issues related to the simple fact that really the truth about folks that are quite heavy is that they like to eat. I know that seems silly, as opposed to other issues. Well, it's my glands. No, they like to eat and feel full of a food that happens to bring a lot of calories. Well, you have to love that person and be a foundation for them and offer ideas. I want you to only eat this much at this time of these foods. Let's do it in this way. and then I'm going to see you again in about 2 to 3 weeks. Or in the era of this smartphone era, we'll be able to monitor their weights via telemedicine from home, along with their blood pressure, their blood sugar, possibly their pulse oximetry, and so forth. These ways in which you'll be more and more connected to empower patients so they can take control over their health. You can help show them the way based upon your experience. You cannot be judgmental. I learned that many years ago in 1973 doing physicals for the very first time. And there was this rather large man in the exam room, and I was this snot-nosed little third-year medical student. I go in the room, there's this huge guy, and I was all of 23 years old. And I say to him, you know, immediately I walk in the room and start berating the guy about his weight. And then he looks at me, and when I finally stopped talking, he said, "Are you through now?" I said, "Yes, sir." He said, "I'm on a diet, and I've already lost 47 pounds over the last three months." And I said, "I'm going to go back out of the room, and I'm going to come back in, and we're going to start over again. And let me start by saying I'm sorry." Help people to take control and power over their own health. Ladies and gentlemen, the reason to get into medicine is to build relationships with your patients. I went home and practiced medicine in my hometown for 20 years. I did emergency medicine. I ran emergency medicine contracts for a large hospital corporation, but I also built my own urgent care center in my own hometown. That was the first $500,000 I ever borrowed. And I was hometown boy, come home. And so for almost 20 years, I operated my own urgent care center where I did a lot of family medicine. And the relationships that I built with people over those wonderful years are something that I cannot begin to share with you, except to say it's the opportunity to be a part of the lives of others. Please go to virtualshadowing.com when you have a moment. I put 2 reading assignments that I want you to complete if you're going to keep doing this. And one is about the mind, which I very much study and read about, is partially within us and partially outside of us. That sounds awfully weird and metaphysical, but it's not intended to be at all. What that article says, and it's very important reading, is that what makes up our mind is the connection, in part, is the connection with the environment. And that means our connection with others. Old folks stay home and stop interacting and they become demented. Keep your mind razor sharp all your life. Challenge it. Complexity. It is these relationships with your patients that you will build that expand your mind into the care that you're giving, and to develop these relationships that allow you to work with folks in a most holistic, total body, mind, and spirit manner. I'm not being, as I said, metaphysical. This is the success to the practice of medicine. Because, folks, when patients come see us, they are often terrified. They have the unknown. You will become accustomed to the skill set you have and the knowledge base that you have. Your patients don't have that. You will look at them and you will think that they have it, but they do not. And so you are the scientist here, the applied scientist of medicine. We'll come back to that. And what you have the opportunity is to mix science with humanity. That is what you do to all patients at all times and in all situations. It's so hard to do sometimes. You're working 12-hour shifts in the ER. You are 11 and a half hours into your shift. Your feet are killing you. You're starving. You're hypoglycemic. The old lady is on your back. The baby ain't got no shoes. The mortgage is due. You got a lot on your mind, and you're 30 minutes away from finishing your shift, and you still got patients to see. There's a lot on your mind. You have to push that aside and go look the patient straight in the eyes and say, "What can I do for you today?" You have to do that, because by and large, patients are so afraid and they feel so insecure when they come and they bring their body to you and say, "Here, what is this? And what can I do to make it better?" Part of the partnership in medicine is that you want to try to enter into a relationship where you can help folks achieve the highest state of wellness that they reasonably can. control or stop their smoking, control their blood sugar, take care of their blood pressure, to get testing if they have funky chest pain, for example, and to find out if they have occult coronary artery disease, to examine their past medical history, their family's past medical history, to determine, for example, what genetic predispositions that they might have, and so on. It's quite one thing in the emergency department that I see, and I've been working ER full-time for tens of thousands of hours for over 40 years. People so often only come in when they're finally reacting to a condition. Their blood pressure is now, that has not been controlled, has finally brought them to having a stroke or a heart attack. What we want to do is try to identify people who have risks and to enter into a partnership for health. Some patients are very difficult to do that with, but nonetheless, we have to do the best we can to enter into that partnership. I mentioned a moment ago about applied science. Here is what medicine is. This is what these virtual shadowing programs are about. You're going to learn an applied science so that you can enter into a partnership for the improvement and maintenance of health, so that you can work for the betterment of the human condition. It is that triad, that trinity, if you will, of issues that come together that make the whole physician. Part of your work as a doctor is to keep up. All the kids in my working group know that I have a flip phone. Yes, I really have a flip phone. But you all have smartphones, I suspect. And ladies and gentlemen, you have no excuse. Touch your smartphone in front of you for the moment. Just touch it in front of you for the moment. You have, on that smartphone, you just touched every fact in the known universe, every formula, every medication description, every diagnosis of any kind of medical problem, if a person has hyponatremia or hypernatremia or hypokalemia, you have all those treatments out there. You have no excuse. And thus, you as a future applied scientist called a physician, if you're going to do this, ladies and gentlemen, it is continual study. I read all the time. All these kids in the working group who know me, Cheyenne, would you agree? We read and talk about things all the time, and Reagan and Taylor, that we talk about things all the time that are coming out. I have never read more about any disease than I have about the COVID epidemic that we're having right now. I'm reading everything that comes out about this brand new disease. Tangentially, we will also talk about that in a few weeks. Very interesting science, and you should be following that because, ladies and gentlemen, I've been in medicine now almost a half century. We've never seen anything like this in my career. I didn't expect it. I thought it would go away. It hasn't gone away. And up to and including our numbers in the hospitals this afternoon for the last 2 months, it's nowhere near going away. So I urge you to study it as an example of the applied science that you will have to learn as a future clinician. Take a long, deep breath. I'll take a swallow of water for a moment. I hope you're enjoying. Medicine is many things. I'm an EMS guy, emergency medical services. I work with pre-hospital care, with paramedics and with the patients that we serve in the out-of-hospital environment. Public health is part of medicine, and every physician who enters the practice of medicine is getting involved in public health, like it or not. And as this epidemic shows you in pre-med, to our working group who are pre-medders or about to start med school, you are in the middle of a terrible time, of a terrible public health problem. Just look at all the issues that have been laid bare for us. What kind of testing? Do we have swabs? Do we have reagent? Do we have places that'll run the testing? Who's going to do the test? Who's going to pay for it? And so on, just for starters. You will have the opportunity, and this is the reason for this slide, you in the practice of medicine one day will have the opportunity somehow to be involved in public health policy making. You will. I was home back in the 80s, 35 years ago, when a Neisseria meningitis outbreak hit my hometown of Douglasville, Georgia, west of Atlanta. And there was a wild outbreak. And we were running a vaccine clinic nearly 24/7 to vaccinate school kids against this terrible often fatal meningitis organism. This is an example of the kind of ways in which you can be involved in public health and policy making in the future. Back to sort of near the beginning, I mentioned to you that, or chatted with you for a moment, that many of you have had your own illnesses. You might have been having wisdom teeth removed, or it might have been an ovarian cyst, or you might have been blessed with children already, or your father has hypertension, high blood pressure, or your mother has severe diabetes. My older brother's oldest daughter, I drew her blood at the age of 2.5, 38 years ago, when she was covered with bruises with a fever. And in fact, I looked at the slide in the laboratory that showed that my own niece, my brother's oldest daughter, had come down with acute lymphocytic leukemia, for which she lived 2 years and passed away. I was deeply affected by that. I realized that a physician who sees illness in his own family or her own family has no rule book on hand to know how to get through the severe illness of a close family person. But, ladies and gentlemen, and as some of you may write in your personal statement for your application to medical school, our own experiences with our own illnesses and those illnesses of our family can guide us. They make us humble. And they make us realize the fact that we have a very personal side of medicine, namely that we have been laid bare ourselves from time to time, and our families, and that we have seen when a wonderful clinician comes in and said, "Hello, Ms. Jones, listen to you, talk to you. I'm going to get you some medicine. I'm going to help you feel better. We're going to take care of this. And if I can't, I'm going to find the person who can. So let's get to work." You hear that and you almost break out in tears and say, "Holy cow, what a nice person that doctor is." But I really trust that doctor because I know that that doctor cares. Now, on your applications coming soon for many of you, listen to me. You are not going to be the king and queen of the healthcare team. If you think that, you're fooling yourself. I worked all weekend. I worked 27 hours this past weekend at Parkland in that big, busy emergency department. And let me tell you something. Yes, I probably have the most applied science training of the members of the team. But let me tell you something, folks. I'm not the head of the team. I'm a member of that team. And so as you write your personal statements, I suggest strongly to you that you're looking forward to being part of the healthcare team, so that broadly, all of you, the doc, the nurses, the techs, the secretaries, the radiology tech, and so on, all of you working together behind the scenes and in front of the scenes are fully committed, all of you, to helping the patients, but you're doing it as a team. Yes, you may be called a team leader, but you are a team member. And your humility, not using the first person singular I ever, you don't need to, I do this, I do that, you don't need to do that. That we, first person plural. The second person plural is so important. It's you. I am so proud of you. And the first person I hope I said second person plural. Second person's, first person plural, we functioning together as members of the team made things better for our patients. It is we that are the healthcare team. It'll be natural that you will find things that you don't know. I read and I study all the time. Focus. I will tell you that you folks, as you're about to get into medical school or going in that direction, artificial intelligence is going to follow you. It's there a little bit already. You have your smartphones and you have intelligence with you. We're going to talk about this some more next week and the following week. You must find the answer to the problem. You are an applied scientist doing a history and a physical exam and doing testing so that you can create a differential diagnosis. I think it's this. It could be this. I don't think it's that, and I know it's not that. Is that so you can develop this applied science. As you study the science of medicine, I would hope that you will find a natural intrigue and appreciation for science. I mentioned on the website of things to read. Please do read. One of them is on the mind. Another is on things about COVID and experiences in medicine. I also mentioned Nick Chater's wonderful book called The Mind is Flat. It's a wonderful study about how our conscious minds actually form memories based upon perceptions. I strongly urge you to read it. I've read it, and it really affected me because I have a natural interest in trying to understand the human mind. The great thing about emergency medicine is we see all conditions in all ages, at all hours, of all genders, of all races and ethnicities, in all languages. And it is so natural to be able to approach any disease. You may or may not go down that path. We will get into specializing in the next week or two. Specializing is when you decide to go down a path of becoming a specialist, as opposed to, in my case, I'm sort of, you might say, an emergency general practitioner. I see all things, as opposed to an ophthalmologist, an eye guy, who sees a certain number of things. But welcome that natural intrigue. And ladies and gentlemen, always read and always study so that you, as the applied scientist, will demonstrate that you are a lifelong learner. Folks, I've been studying so much about this COVID disease. There's a word, I'll give you your word for the evening if you don't have it. It's called protean, Protean. It's after, I believe, the Greek god of the sea, I believe it was. But what protean means is multiple manifestations. It can come out this way or that way. COVID is a protean disease like nothing we've seen in forever. So I urge you, as an example of being a lifelong learner, to study this disease as it comes out. Again, we will be sharing one of our talks with you very soon about COVID. So to enter medicine then, to finish this slide, is a commitment to lifelong learning. And so I would urge you to make that investment as you move forward. Some of you have been led in your family by someone who has been in medicine. And a reason to pursue medicine is so that you can carry on that tradition. Here is the gift we have for you tonight. We are passing these thoughts along. For example, in a session in a few weeks, maybe the fourth session to come up in June, I'm going to do Fowler's Laws. Well, they're not my laws. Somebody gave them to me, but it's Fowler's 15 Laws of Safe Emergency Medicine. All of my residents know Fowler's first law: always explain a tachycardia. If you see a sympathetic response to a condition, you must explain it before you let that patient out of your sight, for example. Regardless, though, what we're saying is that we are giving this to you. This is now yours. You must one day pass it along, just as the physician role model in your family may have passed it along to you. I'm so excited for you about entering medicine at this time. When I first entered medical school in 1973, some of you will smile at this, the trilaminar membrane of the cell had just been described. I was actually handed an article in the fall of '73 looking at the trilaminar membrane. So much has emerged in the last 47 years since I entered medical school. You are going to find all kinds of things that you're going to be able to study. We're going to, in your career, not in mine, I'm at the tail end, I'm in the autumn of my career, but you're going to see cures for very important diseases. In 1973, when I started medical school, Harrison's Principles of Internal Medicine described Hodgkin's disease, that deadly lymphoma, as a fatal disease of the immune system. Hodgkin's disease today is the go-to lymphoma if you have to have one because it's so treatable. Metastatic malignant melanoma, the black moles, that can turn into cancer and spread all over the body, was a fatal illness when I was a kid. Jimmy Carter, past president of the United States, at the age of 90, with brain metastases from malignant melanoma, was cured. You're going to see so many things as we continue to understand and learn about the pathways in the human body. You want to be part of how to educate your colleagues. You will become an expert in the field, and you will be able to be someone who is able to share explanations on improving community health. An example of that is from 1848 with Ignaz Semmelweis. Semmelweis was the discoverer of the fact in the lying in hospitals in Vienna in the late 1840s that doctors were actually transmitting what was called puerperal sepsis, also known as childbed fever. Septic endometritis is the name of the disease. They were carrying the disease from infected mother to infected mother, killing people. Semmelweis saw this, and he made his team on his ward bleach their hands. And what did he come up with? His death rate went to 0. But the problem was he was a jerk. There's another word that's a 2-syllable word. He was a jerk, and he couldn't convince people. He lorded his knowledge over people, and ultimately was fired, lost his mind, and where he could have helped save millions of people in improving community health, he was smart, but he couldn't communicate. You will become great communicators soon. And as we're about to close, getting into medicine will also do this for you. It will help you not only broaden your way into clinical, meaning medical activities, but it may take you up what we call the C-suite, the corporate food ladder, food chain ladder into corporate medicine, for example, or perhaps into other opportunities that takes your skill for helping people and applied science into another opportunity to improve health, as well as find opportunities for yourself as well. But in the final analysis, what you're really doing is this. You are developing a relationship that is built on trust. And that is the opportunity to help better the human condition. I cannot state this any stronger. In closing, firstly, I want to thank you. There are 246 participants, which includes our working group. So for having made this up, we made this up a week ago. Well, that's kind of cool. And if you want us to, and you chat and tell us to, we will keep doing these. And we'll take a little exam. You'll get a certificate. And as far as I'm concerned, that you went to get shadowing hours when there were none available. So we will give you a document that said you showed up and you listened to the talk and you took an exam and you have a certificate to show it. Is it any good? I don't know. But I know that I'm going to stress it at UT Southwestern as in August when we start our admissions committee meetings. In closing, I want to come back to the first slide's topic that says, do you realize what you're getting into? I'm an old man. I'm 67. I am the very kind of guy and gal that is in danger from COVID because of the fact that older people, especially older men, are at higher risk having a serious outcome, including death from COVID. And yet I've continued to work because it's if I don't, who will? So we must. And I think that that's the path you want to speak for yourself, that if I don't do this, who will? This headline is from today in the Texas Medical Journal, and it talks about the palpable fear that those of us on the front line of patient care are feeling, and that actually there's an impact on physician morale and on mental health as well. Ladies and gentlemen, we can do this together as partners. We will help you. We'll communicate with you. But understand that fear has to be reasonable and that you can guide that fear into making a difference for others. So just to conclude, your future, folks, is as clear as your imagination. You have only to dream. But as you will hear next week about the admissions process, you have to dream realistically to make it happen. I want to thank you for letting me be with you today, all 237 of the 236. And Reagan, I think we've got about 20 minutes, 18 minutes for the hour. Also in chat, if you want us to go longer than an hour, I don't know why you would, but if you'd like that, let us know in chat, and we will, and we'll certainly give that consideration. So Reagan, let's take 3 or 4 questions. What do you have for us?
Yes, we have a lot of questions. So I think one of the biggest questions is they want to know, how can we put virtual shadowing onto our medical school applications, and is it equivalent to regular shadowing hours?
We made this up a week ago. I am on the admissions committee. I personally at UT Southwestern will give it consideration. This is not a UT Southwestern product. We're doing it on our own, and I'm doing this on my free time from my job at UT. I would say to you the fact that since you could not get shadowing hours, that one of the professors of emergency medicine and his team at UT Southwestern put online virtual hours to talk about the medicine experience, case-based response that allowed questions, let you take an exam, and get your certificate of attendance. Will that be of value? I don't know. What I do know is happening is that virtual experiences are the norm now. For example, I'm on the committee that is the Graduate Medical Education Committee for Southwestern, looking at how we're going to be doing our interviews for residents this year, all virtually. So I think virtual activities are the ways of the future. I can give you no guarantee, but I would say topic number 1 hour of shadowing with Dr. Ray Fowler on you know what you're getting into with the practice of medicine. Here is the exam and the certificate. You know, the worst they can say is that, well, so what? But on the other hand, if you all keep coming back and we do these once a week, you could get 50 virtual shadowing hours a year if we keep doing once a week. All right, Reagan, what's the next question?
The next question is, how do you advise speaking to patients in a way to inspire hope, but still come across as realistic and not too idealistic?
For me, and I'm only going to speak for myself, if you come online in the next few weeks and y'all keep coming, we'll have a whole bunch of different docs of different ranges, psychiatrists, neurologists, family medicine, OB-GYN, and so forth. I go in and sit down with the patient. It's a little harder now with masks and on, but I go in and sit down. I often sit on the bed with the patient. Some say that's kind of old-fashioned, but I do. And I just start chatting them up a bit, getting to know them. Hey, where are you from? Is your family here? What's your background? What do you do? So what brought you to see me today? Oh, I see you. How long has it been there? To allow people to express, let me start that sentence over. The great diagnostician is one who can help the patient tell their story. This is absolutely the truth. And so that you have to guide the patient into being able to tell their story, because they may not know that certain elements that they may not have thought of are not present. Moreover, if they didn't have certain symptoms and not having them rules that out, then it would be, they won't even know that that's what's called a pertinent positive or a pertinent negative. So it starts with just warmly showing a genuine interest, looking them straight in the eye. There's such a temptation to go to the computer that's halfway across the room with the back to your patient. Please don't do that. Don't do that. It doesn't lead to happiness in the practice of medicine, and it gives the patient the perspective that we are not legitimately interested in their condition. Next question, Reagan.
So this is a bit of a long question. So this person, their question is in regards to the reasons to pursue medicine. It says, for individuals who are still finding our mission and our why, what are ways in which we can find personal experiences to highlight and pinpoint the foundations of our mission in medicine in greater detail?
That's a great question. I will tell you that in the now 9 years that I've been on the admissions committee, I've come to understand more and more, and I think we're focusing more and more on people being able to tell us why they want to do this. Here's one of the reasons. We have 230 spots in each medical school entering class. This gives us a chance to make 230 to teach and bring into medicine, 230 doctors per year. If someone gets into a medical school class and after a year or 2 or 3 drop out because they're just not really interested, that is, there's not a person that can come in and take their place. That's one less physician for the state of Texas. And so we very much on the admissions committee ask people to be able to state why it is that they're doing this and why it is that they want to do this. Now, back to your question. Your question is about trying to find out what really interests you. There are 2 ways to do that. One is to write and study about yourself, old-fashioned pen, cursive writing, and a piece of paper, and actually recording your thoughts about what you enjoy. I started out in pre-law at Georgia for the first year, and I hated it. I changed my major to pre-med in 1971, and I never looked back. When I got into the sciences, I realized I enjoy this. This is what I want to do. I didn't know what I wanted to do in medicine. I backed into a job of emergency medicine, which I'll talk about in a couple of weeks. And so what I did more is that I ended up more through trial and error. One of the things about shadowing experiences and also with the community service activities is you get involved in things and you find out what you like. Finally, getting guidance from your parents and from your other family members and people that know you well. People often know as much about you in some ways that you know about yourself. That, well, son, you really, and my father said it to me, son, you enjoy the sciences, you know that. And he sort of helped convince me to go down that path, which I have no regret for doing. Good question. Thank you. Reagan, next question.
Next question is, do you have any regrets pursuing medicine?
That's a great question. I'm 67, 42 years. I'm a professor in a medical school. I work with the 9th largest urban EMS system in the nation. And I am surrounded at work with the best friends of my life. Present company on our working group here included, just wonderful people. I did not early on in my late teens and even early 20s necessarily get into all that much of being at the bedside. I didn't know a lot. And so I think I was quite nervous, frankly, scared sometimes. And I think I also wasn't all that chummy with people. That was me coming out of high school and into college. Today, one of the great honors of my life is to go into a room and have a patient that I can get to know and talk to and find out about for a lot of reasons. I enjoy the interpersonal interaction. That's part of what makes my day. I will say to you, if you want to come to Southwestern and come hang out, and once we can get shadowing in and come spend some time and to the faculty club, and we'll sit in the bar and have a Coca-Cola, and maybe we'll meet a Nobel laureate there who will say to you that go into medicine for the right reason, which is to help people. Because if you really are interested in that the whole rest of it flows. So to finish the point, as we are now about 9 minutes away from concluding the hour. I have no regrets at all. I'm awfully glad. One of the things that keeps me going is I read all the time, because emergency medicine is so complex. It's every rash, every problem with an eyeball, every respiratory condition, every gastrointestinal condition, and so on and so on. It's everything. Plus, I get to share it with the residents and students that are coming along, so I get to make a difference, I like to think, down the road. And one last point, all of my residents know Fowler's first law. Fowler's first law. Always explain a tachycardia. That's a gift for you, by the way. If you come and shadow me and I ask you Fowler's first law, you remember it. Because that means you're explaining that the patient's having a sympathetic response to a condition, a fight or flight response. Yeah, they might just be nervous, or they might have taken an albuterol inhaler, but they might also be septic, pulmonary embolism, in shock, and so forth. And so we've had 500 emergency medicine residents come and go during the time I've been in this program. It's an amazing. We have 22 residents a year. And each one of them will probably see 100,000 patients in their career. 500 times 100,000 is 50 million. Old Ray here has touched 50 million lives with just being careful of looking at the patient's vital sign. I'll take that. That's a distinct honor for me. It's let me pass things on. I've affected a lot of lives, but it gives me a warm sense of worthwhileness, and that's perfectly valid for anybody to do. Let's take one or two more, Reagan, and then we'll knock off.
How do you convey bad news to patients with chronic conditions, and how do you console them in both an empathetic and realistic way?
That's a wonderful question, and that's a question that's written with humanity. All of you going into medicine, or if you don't end up in medicine, on some related field that has to do with people and their physical condition, whether it's physical therapy or an optometry tech, or a radiology tech and so forth, you're going to have patients that are not well. And I can think back the many numbers of years in which I've had to give awfully bad news to people. I had a patient recently who came to see me. He was a nice fellow about my age, who had lost 20 pounds over the last few months, and it did not intend to. Ongoing weight loss when you're not actively dieting is often not a good thing. And so he also felt something in his belly, which I could feel also. I did a scan, and in fact, I found this guy had a basketball-sized mass that it turns out was cancer, but at the time was almost certainly cancerous. And so I went to the fellow. He was a very bright guy, computer sort of guy, and we went to the computer and we looked at the scan together. And I said, "This is what I think this is. This is what else it may be. It may be quite serious, and we have got to immediately get you into care with the best possible people to manage your problem. And I'm going to personally see to make sure that we get you the right help." I remember when I was quite young that when I had to give, I remember telling a man that I knew back in the early 80s that he had metastatic colon cancer that had spread all over his body. And I remember that I almost giggled, not out of any kind of humor about it, but it was the fact it seems so odd to me to have to tell a patient that they had what could be fatal illness. It was very odd. What happens is that with the passing of time, you become comfortable in your craft and in your field. You must not, now this is important, we're almost done now, so listen to this. You must not allow yourself to get emotionally overwhelmed about something. It can be easy to do, to get overwhelmed and actually nearly faint yourself. I've seen this happen. And so as you become good at what you do and you become skilled and you deal with more and more patients, you will begin to gain the knowledge to do that. We're about ready to wrap up here. This is what medicine is. It's two things. You're going to get a whole lot of book learning that you're going to pay money for to go to school. But something that you cannot buy is experience. Now, I know you hear this all the time. The old guy sitting here, well, in my experience, well, the truth is the fact that you cannot buy experience. You can buy the book learning with appropriate aptitude and willingness to work. But the only way you get the experience is to get on the horse and ride every single day, every single shift, every single patient, and the thousands and then the tens of thousands of patients will pass you with the passing time. And you will realize that this thing of taking care of people has become part of your soul. And that is a wonderful reason to get into medicine. Reagan, let's do one last question and then we'll stop for the evening.
Okay. What's the best advice that you have for those of us who may be nervous about making a mistake in a shadowing or volunteering situation due to not having a lot of prior experience in a clinical setting?
Show up early. Let me tell you something real quick. There was a study done at our university here looking at the following. This will seem odd to you, but let me tell you about it. And I want you to think about it as part of your homework assignment if you come back to the next time when we start talking about the application. We did a study, I was not part of it, but it was published here, looking at are there any behaviors of medical students that end up being predictive of being disciplined by the medical board later. Do you understand the statement that I'm making? Are there any behaviors that med students demonstrated that were predictive that later that they might end up getting into trouble with the state licensing board? Well, they did find two. What do you think they were? And it wasn't coming to work drunk, though that could have been. It was being late to class and to rounds, and to not completing assignments on time. What does that mean? It means people who don't take their responsibilities seriously. Don't get into medicine unless you do. So back to the question, and then we'll stop, is that be early, be appropriately dressed, have your equipment, read about the cases that you see, be honest about what you don't know. For goodness sake, don't ever do something that you're not trained to do. And be honest with the people that you're working with, saying, I don't know what that is, and please help me understand. It is from that your number of patient experiences grows, and the information that you need to take care of patients grows as well as you develop the applied science of medicine. Well, I'd like to thank you for coming. Please let us know if these things should be longer, or do you want us to quit? We're here for you. I kind of like the idea of virtual shadowing. Please go take the test. Part of the test this time, first time, is to say, what else would you like to see, and do you think we ought to keep doing this? If you are, we'll be here for the next 3 weeks anyway, and then if we continue to see folks wanting to participate, we will be here. We've been going for 57 minutes. I want to thank you for your kindness And with that, we will close our session. Reagan, thank you for putting everything together into the whole working group, and thank you very much for coming.
Okay, so there have been a lot of questions in the group chat, and I think it's awesome and great. So I want to kind of talk about a few things. So we will certainly be having some guest speakers from other specialties. So I believe we do have some type of Google form that is ready that Rachel has put in the chat, but we also have an About Us page on our website, and there you can type in what kind of specialties you want to hear from, whether that's OB-GYN, cardiology. There are a few PA people in here, so if you want us to bring in a PA person, we can certainly do our best to do that for you. So a few of you wanted longer talks, so our group will certainly discuss that and see if we want to go for maybe an hour and a half to 2 hours. It does look like a lot of people wanted that, so I think 2 hours would be great too. The quiz. Okay, so for the quiz, you can locate that assessment by going to QuestBase, and I'll put a link in the chat for that. You can either use the link directly. If that doesn't work, just go to QuestBase, and I'll also type in a 12-digit code, and you'll be able to look it up that way. Or you can type in the keywords virtual shadowing, and that should also bring it up. If you have any issues, go ahead and just email us at virtualshadowing@gmail.com. And then credit. Oh, okay, so some of you were worried about if this continues, if you'll still get credit if you aren't able to join the meeting due to a class time being in the way. So what we're planning on doing is we're going to record these sessions, and we're going to upload them probably to YouTube or our website, and then that way we'll also post the assessments. And if you want to take the assessment, then you can get credit that way, and we'll go ahead and provide you the certificate. So I think that is it. So go ahead and fill out the Google form. Make sure to do the quiz. And then next week, we are going to be talking about the road to a career in medicine. So we're going to kind of be talking about undergraduate scheduling of your MCAT, your classes, what kind of classes you want to take in what order. We'll be talking about primary applications and a lot of stuff on that. I saw a bunch of questions about that in this session, but I think it's better if we cover it next session. And then we'll also be talking about secondary applications and the Casper test. And then interviews. We'll be doing interview questions. So I think that is it. Unless I see a few more questions in the chat box, y'all are good to sign off. I'll stick around for a little bit in case anyone has any other questions. But that is it. So thank you so much for coming, and we hope to see you next week. The Google form should be in the chat. Rachel, can you send that again? Thank you. You can still get the certificate even if you came in late or missed a little bit of the session, as long as you take the assessment. This one is pretty much just kind of your opinion on what you want to see and how we can improve it. So I wouldn't be too worried about the assessment this time, but we will also be posting it to our website or YouTube within the next few days. And there's no time limit on the assessment, so take it as soon as you can though. And Rachel did post the Google form. Thank you. Our group is, so we kind of got started because Dr. Fowler and I, it was kind of our mission to create a shadowing program that allowed students at my university, the University of North Texas, to get better accessibility to opportunities with physicians. So before coronavirus, it was just going to be for UNT and UTD to get with the physicians at some of the local area hospitals. But obviously COVID-19 came in and kind of crashed and burned that idea. So we changed it a bit and we changed it to virtual shadowing. And then we kind of just, as we got some involvement from some people from different schools in Texas, we kind of pulled them all in and we set up this program and we kind of sent it out to our schools, and that's how you all got access to it. And so we're just super excited. So I hope you guys really like it, because I think it's a wonderful opportunity, especially during this time. Dr. Fowler's first law is always explain a tachycardia.
If any of the working group would like to pitch in, there's still 124, there's 114 people still online with us. There's absolutely no reason we can't continue just to chat among ourselves. I've got nothing to do until I go to work tomorrow at 7 o'clock. So, Ilana, you're kind of quiet over there. What'd you think?
Okay. It was really good. Yeah. I learned a lot, and I mean, we worked on this for a while, just trying to get the PowerPoint stuff done and everything, and I feel like you explained it a lot in detail, so I think we should keep doing this. I know a lot of people were saying to have this done in 2 hours or more, or we could do short periods in the week too. I think that's a great idea. I think we should start. This is a really good turnout. We have a lot of people too, so it shows that, you know, virtual shadowing, it's sometimes hard to get shadowing in general, even if the COVID virus wasn't here. Like, it can be really hard. So I think this is a great opportunity. So
who won the $2 bill? For those still on the line, we were trying to say, are there going to be 10 people show up, or 100, or 150, or whatever? And Miriam, I think you said what did you say, 250?
Yeah, I said 250, and I saw there's like a max of 248 people that came online. So I was too short, but
So you get the $2 bill.
Awesome.
We, for those still online, we actually put this out about a week ago, and we had 350 or more emails to us from the website. So we would welcome your comments on the website. Also, what you like, what did you not like, but you'll have that opportunity also on the exam that they put together.
Dr. Fowler, also some people were wanting to know how to connect with you. I know you probably don't want 500 emails, so maybe think on that one and see, but I know a lot of these students really appreciated your time and your wisdom. So if you would be willing to connect with some of them, I'm sure they would greatly
I absolutely will. My email address is reagan.rosenberger at utsouthwestern.edu, and you're more than write her a note. We wanted to do in-person shadowing, and we're going to do that, and we're going to try to build a network where we can get not just me, but we've identified 30 of our faculty that we think would be willing, and if necessary, more so around Texas, so that we would could have the opportunity to help you move forward in your clinical experiences. Rachel, you're kind of quiet over there.
I was muted for most of it. I'm really happy about the turnout. I hope everyone fills in the Google form, and we'll send out links through that. I think we'll be posting the Google form on the website, correct?
Yes,
Dr. Fowler, did you put the link on the website for the assessment?
I have not yet. As soon as you send it to, I've got to go to my email. I'll put it out there after a while, in a little bit.
Okay.
Texas Tech, are you still around or no? She's not there. Ani, what'd you think? Any comments?
No, I think you did a fantastic job, Dr. Fowler. That goes without saying. Reagan did a great job of moderating. I think if you want to do the rest of the sessions as well, Reagan.
No, it's okay. I'll let you guys do some.
Yeah, we're very excited to have this program started with y'all. I think that I'm most excited for the future sessions with the different specialties that we're going to get different doctors in and kind of ask them how they're, what they think about their careers, kind of like interviewing them about their jobs. So I think it'll be an exciting opportunity for everyone. So it went well. This one was really good, I think.
Dr. Fowler, there's a question in the chat. It says, what do you recommend for people such as me that are U4s that are late in deciding on trying to become a medical professional?
The oldest person that I can recall that we brought in, that we accepted to our med school was in their late 40s. It's never too late. Many people who later decide to go into medicine may have gone to college and not had great scores. And so they're trying to get into medical school with a college score of, say, 3.0 or 2.9. And now they're trying to do makeup after that. The principal issue for tonight is that, and we'll talk some more about it, roughly about 40% of people who apply to medical school actually get accepted. And depending upon the school, it's quite a bit less. For example, we get 5,000 applicants here for 230 spots. So if you apply here, you get about a 4.8% chance of getting in here. And so if you really want to help people, and if you really can't get into medical school, that's not a failure. It's just something that's directing you in a different path. And so you have to find out where your path will lead you. So we are happy to maintain a dialogue with you on this, and to see if we can help you sort through things that can help you make your decision for your pathway. Well, Reagan, why don't we call it an evening? I want to thank everybody who was in the program tonight and all the attendees. It was an absolute pleasure. And we look forward to being with many of you, if not all of you, next week, 7 o'clock next Tuesday, right? Rachel, you're leading the show? Mm-hmm. And we'll be talking about how to fill out your application, get in med school, and we'll be talking especially how to write an essay and how to complete various amounts of the documentation to try to optimize your ability to be able to get in school. All right. Good evening, everyone, and have a great evening. Thank you. Good night.